Welcome back. We're here with Dr. Michael Rowe from the Rockford Spine Center to talk about neck and back pain that apparently doesn't just affect adults, it affects children too.
Correct.
So how do you know if a child is suffering from serious neck or back issues?
Well, it can be difficult. The truth is about a third of children will complain of back pain or neck pain at some time. Luckily, the overwhelming majority of these cases are benign and self-limited, meaning it'll get better on its own. However, there are two things to really consider when thinking about the health of your child's spine. There's deformity and pain. Deformity would include something like scoliosis, which is an abnormal curvature of the spine. Pain would really be pain that's severe enough to keep kids from participating in activities, pain that requires medication in order to control it, pain that awakens a child from sleep, or pain that is not just in the back but goes into the buttock or leg. These are signs that a visit to the pediatrician is warranted.
And what usually causes this pain or even scoliosis?
Well, pain is caused by a variety of causes. Sometimes carrying a heavy backpack has been shown to cause back pain in kids. There are more serious causes of pain. A common cause is stress fractures that can occur in the low back. This happens in about 10% of children and does not require an injury or any trauma to cause it. There are more rare causes for pain such as infections or even tumors. But again, I would say that the majority of cases are really benign and will get better on their own. Scoliosis, interestingly enough, is not painful.
Oh, interesting. Well, what's the best way to be preventative?
Well, I think the smart things to do would be to stay active, stay fit. There are things that can be done in terms of good lifting technique, good bending technique, avoidance of excessive weight gain, and avoidance of smoking. But these things are pretty much common sense, what we call good back health.
Absolutely. Well, if you are having an issue, what should you do about it?
Well, the most important thing is to speak to your pediatrician. If you have any doubts at all, speak to her or him, and they will determine whether or not specialty evaluation is warranted.
And what are some of the problems that can occur if you don't do something about it?
Well, like most things, medical conditions are more easily treated if they're caught sooner and treated then. Conditions such as stress fractures or scoliosis are easily treated in childhood, but if they are left untreated through adulthood, the treatment is usually more involved and the recovery more extensive.
So it's definitely important to do something about it.
Absolutely.
So who can they contact for more information then?
Well, like I said, I would start with your pediatrician.
Pediatrician. Okay. Okay, great. Well, thanks so much, Dr. Rowe, for coming on the show. We're going to move on to our medical stories here. A new study shows people in England deal with less chronic